Mr. Chairman, HHS has really broad and critical responsibilities to protect and preserve healthcare and social services, from women's health to childcare to biomedical research. That's just a few. In light of last night's tragedy, I do want to express my thoughts and prayers. But it is, I think, a painful reminder to all of us that we need competent people running our federal agencies to respond when a crisis strikes. Mr. Kennedy, let me start by talking about vaccines. I think we all agree that cancer is particularly nefarious chronic disease. And the American Cancer Society reported earlier this month that women under 50 are experiencing a dramatic increase in the incidence of that disease. Fortunately, there is clear data showing that the HPV vaccine has saved lives and cut cervical cancer rates dramatically. You have called the HPV vaccine, quote, dangerous and effective, and said it actually increases the risk of cervical cancer. Do you stand by those statements, yes or no?
The HPV vaccine, I brought litigation. I represented.
Yes or no?
I represented.
Stand by your statements.
Let me answer.
I'm trying to,
Senator.
yes or no? It's a simple yes or no.
I
Stand by your previous statement.
litigated on that issue. I represented hundreds of young girls who felt that they were injured by the vaccine. That trial is happening right now in Los Angeles.
Well, let me
Those
ask you.
questions will be answered by a jury in that trial.
You said that no loving parents would allow their daughter to receive that vaccine. If confirmed as HHS Secretary, would you recommend that parents get their children vaccinated against HPV?
I recommend that children follow the CDC schedule. And I will support the CDC schedule when I get in there, if I'm fortunate enough to be confirmed.
Would you recommend that parents get their children vaccinated against the measles? Yes or no?
Against measles? Yes.
Well, I just remind everybody that parents look to our health leaders for advice on these decisions. You would be a health leader, and for the record, I would like to put into the record his previous statements on these vaccines. I do want to ask you a question about character. I still believe character matters, and I want to let you respond to this. You were accused of sexual harassment and assault by Eliza Cooney, who was first hired as a part-time babysitter by your family. When you were confronted about this accusation, you said you were, quote, not a church boy, and that you, quote, have so many skeletons in my closet. You then texted Ms. Cooney an apology and indicated you had no memory of what she described. Mr. Kennedy, I'm asking you to respond to those accusations seriously in front of this committee. Did you make sexual advances towards Ms. Cooney without her consent?
No, I did not. And that story has been debunked.
But why did you apologize to her then?
I apologize for something else.
Well, that's not my understanding. Are there, let me just ask
All
you.
you have to read is the text which she published. It's not for that.
That is not how I've read it. Are there any other instances where you have made sexual advances towards an individual without their consent? Just yes or no?
No.
No. Mr. Kennedy, you said that you're going to say to NIH scientists, God bless you all, thank you for your public service. We're going to give infectious disease a break for 8 years.
Excuse me?
You said you just said thank you for your service to our federal employees. You want to give infectious disease a break, that's a quote. Will you support the development and distribution of vaccines for the avian flu, yes or no?
Will I, for the avian flu? Yes.
My time's almost up, but having read a lot and listened to a lot, I just want to remind all my colleagues that by voting to confirm Mr. Kennedy, we would be telling our constituents he's worth listening to. That alone could get people killed before he even lifts a finger, because he does not even need the levers of power to influence people, as we saw in Samoa. All he needs is a megaphone. To affirm his views by voting to confirm him as our highest health official, we should not mince words about what that would mean. When babies die from whooping cough because parents weren't sure if the vaccine was safe, we will have to look them in the eye. When measles sweeps through school, then hospitals, nursing wards, will this be worth it? There are political realities, we all get that, but there's also right and wrong, fact and fiction. And there's also people staying healthy or dying pointlessly from diseases we can prevent because they thought Congress took its job vetting our healthcare secretaries seriously. Thank you, Mr. Chairman.